Okay, so welcome to Common Sense. For those of you who don't know, I'm Dr. Chris Slininger. This is the third of 5 classes in the Health Fundamentals series. It's a new series here at the Pierce Clinic, and I'm very excited about this one. This one was a fun topic because it's not talked about too much, but I think we're going to learn a lot about our senses, not only the common ones, but also the ones that are less known and how they actually affect our health. Okay? Real quick, I'd like you to just take one and pass it down. These are handouts that go with it. You're basically taking one and then the next one will be sitting sideways. So it's just 2 sheets you're grabbing and then pass it on. So the Health Fundamentals series, let me plug this in. That would be helpful. There we go. The Health Fundamentals series is a series about the principles behind health. So a lot of times when we try to do something healthy, we select a method. We actually go for something. We say, I'm going to try X, Y, or Z. I'm going to try a diet. I'm going to try exercising. I'm going to do this program. Those are all methods that we do. I'm going to start with this quote again. For those of you who have been here, bear with it. And the more you read it, the more it makes sense. Ralph Waldo Emerson made a fantastic quote here. He said, and as to the methods, there may be millions and then some, but principles are few. The man who grasps principles can successfully select his own methods. The man who tries methods ignoring principles is sure to have trouble. It's a very powerful quote, and it really sheds some light on the fact that we need to understand context much more than details. When we know details with no context, we usually wander around confused. We usually end up really struggling to get anywhere. We don't get that traction that we need. When we stick with the principles, we can go very far, and you can navigate a whole lot on your own without necessarily guidance. So let's talk about some principles about the senses. What are the 5 common senses?
Smell, taste, touch,
Taste, yeah. Sight. Right. Okay. Let's start by going through the 5 common ones. So we've all heard of these. We've gone through them. We encounter them every single day. So, smell. Technically, it's called olfaction. That's the scientific name. Olfaction is the active process of smelling. So I just went to Webster's dictionary. I kept it very simple for the actual definitions here. You have these on the sheet as well, and all the extras can go to Angie when the sheets that are being handed out. But olfaction, what it is when we smell, you know what we're doing? We're actually inhaling particles in the air, and we have open nerve endings, and on the end of those nerve endings, those little particles floating through the air end up smacking up against them, and it creates a chemical reaction of a particular type. The type of chemical interaction actually defines what we interpret as a scent. So a scent is not the same. Like, I might smell the same molecule as you, but I don't know that it smells the same. I just know that we can agree that if we smell the same thing, we can identify it together. We have no idea if we're actually interpreting it the same. We just have an agreement, right? So smell is very interesting, but it's very common. We all know this one. So, smell a stinky diaper. How many people have smelled that one? I have a 1.5-month-old, and he's hopefully getting out of that soon. That would be nice. But we also smell lovely things. So we have scents that actually guide us towards good things for us, and definitely keep us away from things that we don't want to get near. Okay? Everybody stays near, far away from a bathroom that someone overused. And it's really just letting us have a little fresh air, because fresh air is a little better for us. So taste is technically gustation. What a funky name, huh? The actor's sense of tasting, Merriam-Webster. They keep it very simple. That was the entire definition here. But I looked up gustation over taste, and it's just because it's the technical word. But much like smell, gustation is also a chemical reaction. So we have food particles, and particles of food, I mean, there's so many. And when we have a really good dish with a lot of spices and herbs and everything like that, we are flooded with these chemical reactions of a great variety. And it actually interacts with 5 main types of taste buds. Obviously, we can taste a lot of flavors, but the combinations of these as it touches our tongue in those 5 main areas actually gives us that sense of taste. Does anybody know what the 5 senses of taste are? The types of taste? Sweet, salty, sour, bitter. What's the fifth? No, no, no. It is. It's savory. Technically, the technical word is umami, but savory is how we describe it. So it's that overwhelming sense of satisfaction. So like Chinese food always has umami. MSG hits the umami taste receptors. That's why you just go, oh, Chinese food. I hate it, but I love it. You know. So gustation. Kids have a funny thing with this. It's very, very funny. But the tastes are also leading us. Anybody went to the nutrition class? In the nutrition class, we talked about how the taste is the confirmation of a good building block that we need for our own health. So taste actually leads us to health. Vision. Anybody ever see the Milky Way wide open? If you travel, it's easier. America is pretty cloudy in general, but if you go up high in the mountains, you can actually see the Milky Way quite well. The ability to see, vision, sight, is very simple. Sight or eyesight. What happens is light waves in the visible light spectrum actually come in and they enter our eyeballs, and on the back sides of our eyes we have photoreceptors. And these photoreceptors are rods and cones. There's a lot of interactions there, but basically what happens is that light wave comes in, it interacts with that nerve, and on the back end it sends a signal saying, I received this light of this variety of wave, and our brain interprets it, puts it all together, and we see a picture, a constant picture, a moving picture. And think about this, we only see what's on the visible light spectrum. How many of you have ever gotten an X-ray ever? Or seen an X-ray? An X-ray is not on the visible light spectrum. We actually use material and a source of light in order to basically interact with that light spectrum. So I don't have X-ray vision, but we can create the interpretation of X-ray vision. Anybody ever see aura photography? It's called Kirlian photography. So our body emits energy, right? And as our body emits energy, we actually give off different colors and varieties and magnitudes of light in a non-visible spectrum, which is actually partially visible to some people. They have it's like on the edge of visibility. But here's some pictures of Kirlian photography. This is actually people that were photographed with this, and this is the auras that they were emitting off their bodies. If you look it up, there's a lot of pictures of this, but it's very, very interesting. And if we think about it, we only have a limited capacity to encounter the visible world. It guides us. We see a lot. Magno Reception. It's touch. Big word for touch, right? Ability to detect and respond to mechanical stimuli in an environment. So we have these Pacinian corpuscles, which are basically little nerve endings under our skin. So everybody touch their pants real quick. Just feel it. The difference between your pants and your shirt. We feel the difference because of different levels of vibration as we rub our fingers over things. Does that make sense? So we get to feel things. Something that's very abrasive and rough, we tend to stay away from. Things that are smooth, we don't want to stop touching. We just keep feeling it and feeling it and feeling it. It's gentle, it's soothing to us. Audition. Sound, the power of, or sense of hearing. Sound is actually percussion. So basically something pushes, or if I clap, a sound wave shoots out from that space, and all it is air moving in waves, and it impacts inside our ear. It goes into our ear canal, impacts on the eardrum, and it actually vibrates bones and fluid and nerves, which get interpreted as sound of various frequencies depending on what entered our ear. So we have a great variety in sound as well. So those are the common 5. Now we have at least 5 more that help us interact with the world around us. They help us feel our environment around us and also feel what's in our own body. And these are much less commonly talked about. So let's go through a few really quick so that we have a really good understanding that our body has a great variety to sense. And then we're going to talk about how senses actually help our health. Okay? Thermo Reception. The ability or sensory capacity to detect the temperature of the environment and the body. So it's hot or cold stimuli. Whenever we touch something hot or cold, it triggers that nerve to send a signal about what it is, how hot or how cold it is. So it's just basically a big scale, and it sends the signal to our brain so we can experience hot or cold. So if we experience something hot, too hot, we're going to say, whoa, that's too hot. If we experience something cold, it's definitely gonna jolt us a little bit. And if you actually get into the damaging realm, it interacts with a whole different system. We're going to talk about that in a second. Gravit Ception. This is real. This is the ability to sense the pull of gravity. Everybody point to gravity, to where it's pulling. How do you know? Well, close your eyes really quick. Lean to your right, and point to gravity. Do you know where it is? Everybody's pointing down, except for one person's pointing a little crooked. But gravity, graviception refers to the sensory process that contributes to the generation of neural signals encoding the orientation of gravity vector with respect to the organism. I definitely pulled that off the internet. I did not make that up. But what that's saying is I can use and incorporate a whole lot of my senses to feel where pull is pulling me, where gravity is pulling me, where the earth is pulling me. We don't go anywhere else, so it's just the earth. If we had a big magnet, we'd be able to feel the pull of the magnet slightly and understand that there's something pulling that way, and I'm still being pulled down as well. But basically what it is it uses the joints and the muscles and the discs. There's nerves in the discs of our spine, and between all of those we have this orientation. So even if I'm bending backwards or doing a handstand, I can still feel where gravity is pulling me. If I'm underwater, you get a little bit of confusion because a couple of your senses, a couple of your joints get messed with because gravity is water is very buoyant, so it distorts it, but we still have other parts that sink downward. So that's why when you fall in water, you just need a second and you feel the pull and you go the other way. It just takes a second. You're just reorienting really quick. Okay. Baroreception. This is our sense of pressure. We can sense pressure changes. This mostly refers to the inside of the body, but has anybody ever felt it in their body when a storm is coming? That's baroreception. You have a sense for that. You can feel the weather changes even coming. You don't have to see it, you can feel it first. So what we have nerve endings called baroreceptors inside the large arteries of our body. And this is kind of interesting. If we have a decreased pressure on the outside, a big storm will be a low pressure system. So if we have decreased pressure on the outside, that means the inside expands. So we notice an increased pressure. That's why you can sense it. So not only is this relating to what the pressure is on the inside, regulating our blood pressure, heart rate, things like that, but it lets us know what's going on the outside. So if you actually flipped upside down, if you think about it, gravity tends to pull blood down. Very easy to get blood to the legs. Your arms are a little bit harder, head is the hardest. Flip upside down, you get really flush in the head and your legs kind of feel tingly for a second unless you've been trained to do this. The baroreceptors basically kick on and they go, whoa, what's going on? As soon as you flip upside down, and really quickly they divert the blood pressure so that you have a whole lot of pressure going to your legs because it's going uphill now, and it actually tightens down the artery to decrease the pressure going to your head because gravity's going to pull it that way anyway. And that's why whenever you're upside down, you flip back up, you need a second. It's the baroreceptors that are saying, whoa, 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 okay, here we go. Send signals to the brain about where the pressure is, and really quickly we regain our sense of pressure in the blood system, in the circulatory system. Yeah?
Your insides expand from high pressure or low pressure?
Oh, it reads both.
It reads both?
It reads what the pressure is.
It expands either way, whether it's high or low outside your body?
Oh, no. If it was really high pressure, which is going to be underwater, then you'll feel compression on the inside, which means your body will increase the pressure to resist it so you don't crush inward. It's trying to push back out. Does that make sense? Yes. So you just have a high amount of adaptability, but we require the input first in order to know what to do on the outside.
This may be way off, but what does the altitude have to do with the body?
Well, it's lower and lower and lower as you go higher. The pressure is lower as you go higher. So your body has to be able to pump. That's really a matter of getting enough oxygen So that's going to be heart rate and the force in which it does it. So you might pump harder and faster in order to get more blood. That's why when you walk uphill at a high altitude, you're out of breath really fast and you feel like your heart's pounding out of your chest. It really is pounding out of your chest because you're trying to get more oxygen, but it's really the demand for oxygen that determines that one more than pressure.
I noticed when I went to Nebraska, because the altitude being different, it took me forever to adapt. I was constantly tired. My body just felt, like I needed to be here. You know what I'm saying? Is that all?
That one's more of an oxygen system. So your body needs more oxygen to function normally, and it actually takes about 3 to 5 days to produce enough red blood cells from the bone marrow in order to get that oxygen from the air to the parts that need it. So you have to actually increase the red blood cell count in your body when you go to a different altitude.
Remember that next time.
But there's no way to fake it. I mean, you could get in like a low pressure chamber, but you could just go there and wait a few days and it'll regulate itself. Or go up slowly, but I mean that depends on if you're really hiking or something like that. That's why Olympic athletes train at high altitudes. They increase their red blood cell counts, and then, except for the winter games, all the summer games are usually closer to sea level, so they train way up in the mountains, have a ton of red blood cells, so when they go to sea level, they have so much oxygen available in their body because they have so many red blood cells. They're super saturated with oxygen. That's why they can compete at such high levels. It almost seems inhuman, but they won't train at sea level. They will never train at sea level. Nociception. This is pain. I was talking about this with thermoception, but nociception is the perception of painful stimulus. So basically, if something is damaging or painful, like it could be damaging, there's a different set of nerves that send that signal saying, whoa, hey there. And these nerves actually are very interesting because they do go to the brain. We can sense pain, but they also go to reflexes. So some of these nerves, when we touch something, let's say I touch a hot stove, our reaction is this. Before I think about what I'm doing, I'm already back. And then I go, I shouldn't touch that. But I already did, and I already retracted my hand. We actually have a reflex loop that goes from the nociceptors through to our spinal cord and doesn't go all the way to our brain. It just loops right back to the muscles that would cause us to retract. So all the feedback loops for nociception actually bring us inward. It's very guarding. It's very interesting though. It helps us, it guides us, it protects us actually. Proprioception. This is spatial awareness. Now this is not one particular nerve. This is nerves from the joints telling the position of the joints, nerves from inside the muscles telling how much strain or tension is on individual muscles. This is from the discs of the spine, and this is from fascia where there's different pull. And I know we don't know much about fascia, but fascia is basically like a leather jumpsuit under our skin, a little bit. There's a lot to it. But if there's a lot of tension in certain tissues and there's muscle strain, then I can tell where it is. So everybody close your eyes really quick and put your hand behind your body and then don't move it. Open your eyes and look, and is it where you thought it was? Okay, you can tell without looking where your body actually is. That's proprioception. Does that make sense? So these are 5 more senses. Now we have a couple other ones, and some other animals have some other ones. For example, birds have Magno Reception, which is the ability to compass themselves according to the Earth's gravitational field. There are people who have a more acute sense of that. You know, you can almost train to feel it a little bit, but it's not as prominent as in animals like birds, things like that. So, those are the 10 we're going to stick with for today, and this is just to give you an awareness that our body is pretty incredible and sensation is very important. Now there's a really fundamental tenet in clinical neurology. Most of us, when we think about nerves, we think about signals coming from the brain and traveling down to certain parts of our body. So in this example, the brain is telling the elbow, hey, I'd like you to contract, I don't know, maybe let's contract the biceps muscle right here. I want you to move the arm. We get that. The brain controls the body. Well, this tenet in clinical neurology is that the nerve system is a sensory-driven system. So it's not that the brain controls the body as the first thing physically that happens. It's actually that the first thing that happens is we encounter the environment around us, someone around us. We hear something, we see something, we touch something. Sense happens and we respond. Okay? So the nervous system is a sensory-driven system. Now, I want you to think of it like this. I'm going to simplify this whole chart really quick, and we're going to refer to it. So everybody understands brain, body, body, brain, right? And signals going between them. Here's our simplified system. Brain, body, body, brain. We're going to call this a really simple safety pin. You know how it has the two ends and two loops here? Simple safety pin. So commonly we think brain controls body, but we want to look at the way that the body interacts with the brain so that the brain can respond. Now, in order to understand this a little bit better, what I want to do is go through an understanding of what it would be like if we deprive ourselves of sense. Because if we're a sensory-driven system, then the output would be determined by the senses that come in. But if not much comes in, then the output gets kind of distorted. It gets kind of muted. The way that we express ourselves becomes different. So we're going to go back a couple years to the Holocaust. Okay? In this time frame, World War II, the war with Japan, the war with Germany, the way that Germans did testing. This isn't just Holocaust. This is also the way they were doing psychological and physical testing. And there was a massive amount of isolation, deprivation, mistreatment in ways that took people out of any sort of normal environmental context or relational context. Completely depraved them of literally their humanity and their experience of life itself. So this is not just Holocaust. These are soldiers, prisoners of war. When they wanted to get information, they would isolate people. They would take away all their senses. They would take away all their friends. They would threaten them. They would make them question their friends, so they would no longer talk to the people around them that they used to trust. Deprive, 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 deprive. So we still have sight, you can still see that, but in a sensory deprivation kind of thing, you'll take away sight, put someone in a dark room, no sound comes through, there's very little to touch. Sometimes there's a restraint, so you have no proprioception, you can't even move, so you're not getting really any awareness of your body, no feedback. Basically completely restraining somebody's ability as close as possible to total blackness. And I mean, these POWs, they come out like this. This is also food deprivation, so you're not even tasting. You're also not getting nourishment. This is a large part nourishment, okay? But here's a study. This was from a British medical journal. And this is about 20 years after the war when they really they were studying it. And we, even in the US, were still doing a lot of sensory deprivation experiments, but we weren't doing it in such a restrained fashion. We would put people in a room where they had a button that they could push to get out. So they were basically told, stay in there as long as you possibly can. And people were like, couldn't handle it, even in a day. Like 24 hours was almost unbearable. And this is not total sensory deprivation. It's soundproof, lightproof, very still air, no moving parts, very still walls, very minimal clothing, so they didn't have much to touch. Does that make sense? Okay. So under conditions of darkness and absence of external sounds, the task of self-orientation becomes more and more difficult, especially if the prisoner, this one is particularly talking about prisoners, feels he must not talk freely to himself because of the certain presence of recording apparatus. So I think I'm being heard, so I won't say anything. So you can't even hear the sound of your own voice because you're too scared to talk. He is dependent on a greatly restricted sensory intake, most of which must be initiated by himself. In other words, I just want to rub the wall, or, you know, I'm just trying to do anything, like feel anything at all right now. Under these conditions, the distinction between dream and reality and between self and environment becomes less clear. So you can't even tell what's you and what's not. You can't even tell what's real or what's not. You start to not even be able to tell if you're awake or not. You can't tell anymore. There's evidence that the maintenance of consciousness and the individual's awareness of his relationship with the environment is dependent on a steady stream of sensory impulses, both from without and from within. We need senses from the outside as well as the ones from the inside. Okay? We still do this today. This has not really stopped. Sensory deprivation. This is 1962, so this is still just a few years after the big war, and they're still exploring this a little bit. Some workers have described a well-marked sequela to sensory deprivation, including disturbances of thinking, imagery, time appreciation, and delusional and hallucinatory phenomena. So basically, same thing. I can't tell the difference between dream and reality. I don't even know if what I'm experiencing is the real thing. I don't know what time it is. I don't know where I am, where I'm in space, and even to the point where you don't even know kind of who you are. Does that make sense? So it's getting kind of dark. I know it's deep, but it's important to understand this because we can understand a lot about what we're made for and how we're made. This is more of today. This is more of today. We still do isolation in prisons, where we take away all contact. If someone is very violent, their response is usually more severe. They will restrain you so you don't get feedback. In this particular case, your sight's taken away. You're in a room with no sound, just the echo of your own voice. Again, if you're worried about being heard, you might not talk. You have very little in. Very little in. In solitary confinement, they did some studies. Numerous studies have documented the effects of solitary confinement on prisoners, giving them the special name Special Housing Unit Syndrome. Some of the many SHU syndrome symptoms include visual and auditory hallucinations. We talked about that already. Hypersensitivity to noise and touch. Insomnia. Paranoia, uncontrollable feelings of rage and fear, distortions of time and perception, increased risks of suicide and PTSD. It gets dark very quickly. And a lot of these people start to experience this in less than 24 hours. The volunteers that did it, that could get out, they were experiencing some of this stuff within 24 hours. So imagine more days or weeks or months or years. And that's happened.
Oh my gosh, yes.
Has it changed much? This is the free world. The free world, you know. What do we experience these days? I mean, it's very common to walk into an office building. I mean, a really nice one has a nice reception. Usually has some color on the walls, and the desks are made of like marble. It's kind of colorful, and some plants and everything. But once you get up to where the general worker is, and I don't mean that in any derogatory term, but this is how we treat our everyday worker in an office building, is we say, here's your gray cubicle, you can put a couple pictures of family, you're going to sit under fluorescent lights, you won't know what time of day it is unless you look at the clock. You get so distorted, the only thing you hear is a constant buzz of stuff, or like the ring of telephones. It just never ever stops. There's no real change. You don't hear a bird chirping. You don't hear really anything natural. You don't hear the wind blowing. You hear the AC come on. Wow, what a change. You don't move much. I mean, to get people to move, who's at the movement and exercise class? We don't move much. We don't move much. All these senses are so deprived. The ones that are supposed to help us thrive are being taken away. And yet we see huge rises in things like depression, anxiety. I mean, these things are just skyrocketing. Let's look at these really quick. Fibromyalgia is really interesting too. Fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. This is from the Mayo Clinic, ready? Researchers believe that fibromyalgia amplifies pain sensations by affecting the way your brain processes pain signals. Pain signals, which sense is that? The technical term, what is it? Nociception. Nociception. So our nociceptors are sending signals where our brain is getting an impulse from the other end that there's pain going on. And the funny thing is a fibromyalgia patient, I mean, you just brush them, they're like, oh my gosh. They walk and it's just like, ugh, everything hurts. Why does everything hurt? Why is your brain getting such junk in You're not feeling pain, you're sensing pain. There's no painful stimulus. It's just this idea that pain is constantly present. There's some sort of distortion going from our body to our brain. Anxiety, an unpleasant state of inner turmoil, often accompanied by nervous behavior such as pacing back and forth, somatic complaints, and rumination, which is just going over something over and over and over and over and over and over and over. But somatic complaints, when they talk about that, when they describe it that way, somatic complaints are feeling something that's not there. It's making something real that's not actually being sensed. So your brain has a reality interpretation of something that's not actually there.
Is this the case where so often I've heard over the years, a woman will have a issue, either pain or something going on, and she'll go to the man doctor. And first of all, the biological difference between the species. And second, he runs tests and things. Tests show nothing. So he classifies her as it's in her mind.
No, that's...
So many women come back and say, well, he just doesn't understand, you know.
Oh, trust me, it's both men and women. We see it every day. And we have seen so many people that have been told it's in your head.
Yeah.
A lot of it's not, but it is. And let me put it this way. The fact that you're sensing it is real.
Yeah.
This is what they don't acknowledge. They say it's all in your head, which means I don't have to deal with it.
Right.
But if we say it's all in your head, so let's find out why, then we could get somewhere. Because instead we're acknowledging the fact that I'm not taking away your sense of reality. What we need to know is why it's distorted from reality. And then we can help somebody instead of write them off. And too often we write people off for that one.
And give them a tranquilizer or something.
Basically.
Or pain medication.
Exactly. So depression, and this is exactly what you're talking about. So depression is basically, it's described in so many ways. Hopelessness, a lack of desire of anything, just feeling nothing. I've heard people say literally feeling nothing, having no emotion. This is the funny thing, is that most of the medication is doing the exact thing that it's trying to get rid of. So the irony is that some of the antidepressants and anti-anxiety medications we use to overcome mood disorders can cause emotional numbness. Okay, and obviously emotion was not one of the senses we talked about, but it is largely taken from what we feel around us. My short-lived experience in taking, this is from like a blog. Somebody with a bit more research and experience was trying to organize one. So this is the writer of the blog, and there was other people that gave feedback on it. So I am taking this from a blog, but it's because depression is largely understood and is usually defined by the person experiencing it. It's so widespread. There's not one set, this is depression, anything but this is not. There's a whole category that really falls into depression. A lot of people can fall into that area. But my short-lived experience in taking, amitriptyline, then Prozac. I'm terrible with pharmaceuticals. I never studied them. But then Prozac gave me a feeling of being flatlined emotionally. I wasn't sad, but I also wasn't happy. I was simply there. No sense, no output, no nothing. It's kind of scary. This is what a brain looks like when you're depressed. Now, think about this for a second. If the nerve system is a sensory-driven system, then what lights up the brain? Nerves from the senses. So if you're depressed and you're not lit up, then you're literally not feeling anything or processing or interpreting. If the nerve system is a sensory-driven system, that person feels, that person doesn't. That's what that picture is actually showing us. It's not that that person has this much output, that person has this much output. It's that that person doesn't feel, that person feels. And because of that, the expression changes. Does this make sense? Are you starting to see it a little bit? There's a loop here. We're looking at this loop. Paxil. Paxil. So this is for depression. These are some of the side effects. Has anybody ever seen a drug commercial ever in their life? It is about 40 seconds of watch out, this might kill you, and about 10 seconds of this is great and ask your doctor. And the entire time they're talking about vomiting, dying, committing suicide. You have someone playing with a balloon or a lovely music and just a wonderful life, right? It's absolutely disgusting. Absolutely disgusting. So these are the more common side effects of Paxil. So, okay, I'm depressed. Doc, I'm depressed. And the commercial told me to ask you about Paxil. So, well, tell me about Paxil. Paxil's going to be great for you. Why don't you take this much every day? Blah, 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 blah. Okay, and then they will give you a quick rundown, and then this rundown will also be on the literature that they give you, which can not really fit on the bottle anymore. These are the more common ones. These are some physical ones, but I found this really interesting in the more common. Sleepiness or unusual drowsiness. Where did we see that before? Sensory deprivation, trouble with sleeping, abnormal dreams, discouragement, feeling sad or empty. Sounds like depression. What's depression? Low input. Feeling of unreality, hallucinations, right? Lack of emotions, loss of interest or pleasure, problems with memory, sense of detachment from self or body, not knowing what's real or not. Tingling, burning, or prickling sensations, trouble concentrating. Think about it. What is this drug doing?
Yeah.
No, let's really think about what it's doing. If I know, it's what?
It's messing up all your senses.
It's messing up your senses so you don't sense the depression of nothingness. So, okay, I feel nothing, doc. Okay, let me give you a drug to stop feeling that nothingness. What can you do? You only mute yourself more. So you spiral into a deeper, basically inward isolation. You don't need it on the outside anymore. You have it in your system. So great. The birds are chirping. I don't care. Something nice is touching me. It doesn't matter to me. What a lovely sight. Not to me. Like, it becomes disgusting. You have no sense of real reality, no sense of beauty anymore, no sense of a lovely world. It gets so distorted from a drug. Now, I found this really interesting. This is WebMD. Tell the doctor immediately if you notice worsened depression, other psychiatric conditions, unusual behavior changes, including possible suicidal thoughts or attempts, or other mental mood changes, including new or worsening anxiety. Oh, we talked about that. Panic attacks, trouble sleeping. Oh, talked about that. Irritability, hostile, angry feelings. Saw that, especially with the isolation for prisoners, impulsive actions, severe restlessness, we saw that. It's funny, you can be restless and tired at the same time, and very rapid speech. What a wonderful thing for us. What a wonderful world. Vicodin, great drug. Wow, so powerful. Most of these opiates involve the central nervous system and the smooth muscle. The precise mechanism of action of hydrocodone and other opiates is not known, although it's believed to relate to the existence of opiate receptors in the central nervous system. So take it and try. We don't know. In addition, this is drugs.com. In addition to analgesia, narcotics may produce drowsiness, saw that before, changes in mood, and mental clouding, not sensing reality. Again, these are our daily drugs. Ooh. It's cutting off our ability to feel. So this is what we have. We have simple safety pin, this is what the drugs do. They go, here, sorry. Normally, you're supposed to sense. We don't like the way you sense. So this is our option. Don't sense. That's it. Drugs. There's chemistry. I hope you learned a lot. You usually have to go get an MD degree to do that. And I mean, I'm not saying that everybody does this, and a lot of people actually don't like these because they understand what it does. But if you understand the severity of what it's actually doing to your body, then you understand how we can actually choose to feel more and therefore express more. It's our choice. So here's Vicodin. More common, drowsiness, we saw that. Sleepiness, Changes in mood, fear or nervousness, unusual drowsiness, dullness, tiredness, weakness, or feelings of sluggishness, as well as a slew of physical symptoms that come with it. The physical symptoms are the output. And the other list, they're also the output. My body's not acting right. Why is it not acting right? Because you have junk going in or nothing going in. So there's nothing coming out. Let's talk about this for a second. If I have, can everybody kind of see this as a bad marker? Ooh, that's better. Okay, in a normal circuit, let's say I eat something, right? And that something goes down to our stomach. We ate a meal. So that food goes in and our body goes, hey, I got food here, just letting you know. Sends it right up to the brain. Great, there's a clear path, no problem. So the brain goes, hey, we got food there. Hey guys, you gotta start making hydrochloric acid. So sends a signal down to the body and says, make hydrochloric acid. Makes it. And then the body's basically like, hey, I'm breaking down enough, we got it, we can move things along. So the body tells the brain, hey, that's enough, thanks. And the brain tells the cells to stop producing hydrochloric acid. It's not an automatic thing, this is not controlled down here, it's controlled up here. So this whole system works and the food moves along and is well digested. Now, let's say your on signal's working. So you eat some food, the body tells the brain, hey, I got some food in here, send some hydrochloric acid. Brain goes, no problem, sends the signal down. Body goes, hey, that's enough. Hey, that's enough. Hey, that's enough. And it's sending the signal, but the signal is not going through, right? It's stopped. The safety pin is open. Doesn't complete the circuit. Hey, that's enough. Keep sending it. Well, what's happening? Hydrochloric acid is being laid down in the stomach. More of it, and more of it, and more of it, and more of it. Hey, that's enough. We got enough here. Seriously, we got enough here. And more of it, and it just keeps going. The brain's just going, do. Whenever you tell me, I'll stop. And it just keeps making more of it because it's not getting the signal. Not getting the signal. This is what we do. We go, I have no problem. I have no problem. I have no problem. Hydrochloric acid is still being made. No big deal, no problem. But what we have, something called a threshold. So basically, when symptoms or problems in our body start, they start before we sense them. Okay? It's usually not right away unless it's a very abrupt injury or something quite catastrophic. But the subtle things that ease over time, like degeneration, why do you only find it once it's 10 years old? Seriously. It's because we have a threshold. So in our example, hydrochloric acid is still being laid down, but it's not sensible yet. It just keeps going, keeps going, keeps going. You know what? We finally have so much we can't even stop anymore, and it crosses the threshold. What do we get? Yeah, what kind of pain in this particular example? Gas? Not gas. Acid reflux, heartburn, ulcers. We start to feel them. What? Not fullness, not full of acid. That would be terrible. But that's what we feel. We go, whoa. There's a big problem here. And we finally get past this threshold. The funny thing is the safety pin's still not closed. So what happens is your nociceptors are going through. You go, whoa, I'm hurting. But the brain is still saying, look, I'm waiting for you to tell me to stop. And it just keeps going and going and going. Then we
get a pill.
Then, what does a pill do? Most of the time, it changes the threshold of the nociceptor. So you no longer sense the pain of the problem. So you know what happens? Hey, I feel great, doc. Brain's still going, hey, tell me when to stop. It's still going, and it's just making it along. And then finally, we have this new threshold, and boom, we go above the threshold. Hey, doc, I know I'm taking that pill, but I still hurt. Yeah.
What does baking soda do? The same things?
Well, it's very basic, so it neutralizes the acidic reaction.
Does it mask the pain and it still keeps on? Or
No, it neutralizes how much acid is in it. So it's like, what's the best way to say it? Like, let's say you have 100 molecules of acid and something acidic and 100 of something basic. One will mask one, so if you make enough baking soda, it just neutralizes the acidic reaction. That's all. So it basically takes away the current hydrochloric acid and the effects of it, but it didn't change the signal. It didn't close the loop. So the nociceptors, finally we cross the threshold again, and the nociceptors fire off saying, whoa, I heard again. But the brain's still going, hey, I'm just going to keep making hydrochloric acid. It's been a while, but I'll just keep going. And it just keeps going. We go to the doc and we go, I think I need either another dose or another pill. Which one? I don't know, let's try this one. And then they change the threshold again. Or maybe it doesn't work and it lowers it and you're like, oh, that's way worse. That's way worse. Is this story at all familiar? This happens over and over and over. It's an open safety pin and we're not closing it. So living without sensing is like living in a dream. Sometimes it's a nightmare. Sometimes it's a nightmare. When we don't experience the reality around us, we really don't know in what context to express anything at all. Or maybe it's muted and it's just partial, but we feel a little bit lost, or our body feels lost and we know that the output is just kind of chaotic, but why is it chaotic? It's because our nervous system is a sensory-driven system. It doesn't take away your identity, right? It's not that. See, I'm still me. I'm still me in a dream. I'm still me in reality. But without the context of reality around you, you have no idea in what way to express the reality in which you are. You're lost. You say, I have this being, myself. I'm me, right? And I want to be me in something. But I don't feel anything, so I have no context in which to express my being. Therefore, I will just isolate myself, which only aggravates the problem. I mean, depression is one of the worst ones because to me, what we do to people that are depressed, numbing them worse is one of the most disgusting things you can do. And the people that have the most success with people with depression is actually the ones that send them away to retreats. What do you do in retreats? Immersion, sensory and relational immersion. You're usually outdoors. They don't do many retreats in cities. It doesn't really work that well. You get away from all the noise. You start to hear the natural sounds. You start to see the sunlight. You do a lot of outdoor activities. You move your body. You sit there with friends. You hear stories. You talk. You eat good food. Not only is it nourishing you, but you're also experiencing the sensation of it. You are totally immersed in both a relational and environmental flood of what's wonderful and made for you. So instead of us sitting in a bunch of cubicles, we actually enter actual reality. And those are the people that heal. Does that make sense? So they're closing the safety pin. They're taking away the interferences, which are actually adding more and more problems. They take away that and then flood you with what you need in order to express yourself. And that's why when someone comes back, they know how to relate to people. They finally have a sense of reality. And this isn't it. We have this in our body too. And this is why we even have this in our clinic, why we have this class at all. This does relate to the human body. Now our nerve system does go up through our spine to our brain, which means if we have any distortion along that pathway, then we're essentially opening the safety pin and the signal's not getting through. Most of the interferences, and although we talk about it, for those of you who are patients, although we talk about a lot of the brain to body control, in reality we actually know that most of what we're correcting is body to brain. If you can restore the signals from the body to the brain, the output all of a sudden becomes much, much clearer. So this is how it works. We concentrate obviously on the upper cervical spine for those of you who know us well, but the upper cervical area, we have the skull, the atlas, which is this ring here, and then the axis. Whenever we're in normal alignment, our body does work this way. It has great input about where everything is in space. Proprioception, Magno Reception. We have a lot of awareness about where we are. Gravit Ception, we understand where gravity is pulling us. So our output is a very erect and strong frame and posture. Does that make sense? Because I know where I am in relationship to gravity and to myself. if I have a distortion of that area and I put pressure on those nerves, distorting them, and it's not just pressure, this is what we normally show. Well, we're going to talk about another factor here. But if my sense of reality is distorted about where gravity is and where my body is, then the output is going to be just as distorted, and that's why you end up with such a distorted posture when you're out of alignment with pressure on nerves. It's much more about the input than the output. Now this slide here, this is actually what we teach our docs that train here, the docs from all over the country. When they come here, we talk about this slide to understand the effects of the input and how it relates to the output, okay? So here we have the skull and the cervical spine and the atlas and axis bone. This inferior oblique muscle is one of the most densely populated areas of proprioceptors. Do you remember what proprioceptors are? Go ahead and look.
Where your body is in space.
Where your body is in space. Okay? So this area, as well as the joint capsules and the discs of the spine, those areas feed the brain. And the densest area is our upper cervical neck. The second densest, can anybody guess what the second densest area of proprioceptors are in our body? No. Just want to see.
Your hands.
Close.
Lips.
No.
Fingers.
No. Go lower. Lower than hands.
Feet.
Feet. Why feet?
We stand on them.
Because we stand on them. Where are we in relationship to the earth? What is the surface below us? Okay? These are two main areas. So the upper cervical spine, the mechanoreceptors, proprioceptors, there's a lot of these that are interchangeable, so I'm sorry for the technical confusion if there is any, but mechanoreceptor, proprioceptor, we're talking about the same thing here. Mechanoreception is also considered touch, but when it comes from the senses of the skin, mechanoreception has to do with texture. When it comes from the joints and muscles, it has to do with proprioception. Okay, so proprioception uses mechanoreceptors to give us that awareness. Am I losing anybody? Okay, here we go. So these nerves go upwards from through the spinal cord, and I'm going to skip some of the bigger terms, but I want you to see what it does. It goes up to the cerebellum, and from the cerebellum it goes back to the vestibular nucleus, and the vestibular nucleus is the area of the body that gets input from our eyes, our inner ears, sense of balance, and our mechanoreceptors to tell us where we are in space. So our eyes help that, our inner ears help that. That's why when you shake your head you get a little dizzy. It messes up that awareness of space and gravity. But the vestibular nucleus, once it gets all that input, its output is posture muscles. So my spine muscles that keep it upright come from those inputs. If the input is distorted, so is the output, right? Spinal muscles, and when we get that, that's why we check legs to find out if you're in alignment or out of alignment. It's actually because it pulls the spine out of balance. You have an inappropriate spasm on one side as opposed to the other of spinal muscles. And you can see when you're lying down. From the cerebellum, it also goes upwards to the thalamus. From the thalamus, it goes to the limbic cortex. Does anybody know what that is? Limbic, emotional center. Cerebral cortex, where we think, where we process. Sensory cortex, again, where we sense, and that's where we can understand where we are. So when I ask you where you are in space, you have a conscious awareness of it, as well as a huge unconscious understanding of it, which controls a lot of the output. All that comes back down and goes down to the hypothalamus, to the pituitary, and the pituitary is in control of the hormones. So if I have bad proprioception, my hormones go wacko. We go to the doc, we say, my hormones are out of balance, what do? Give you a drug to either control the output or alter the input. It's one of the two. But it's not restoring and closing the loop. That's the problem. From the hypothalamus, we also go down to the pons and the intermediate lateral tract. It goes to the sympathetic chain. The sympathetic chain, in short, goes to our ability to interact with the world around us and respond really well. Our immune system is part of that, the blood vessels, the way our blood pressure is regulated, heart rate is regulated, almost every function of our viscera, all of our gut organs, our spleen, our liver, our kidneys, all these are controlled by that. So if we have junk input, we have terrible junk output to just our organs. Does this make sense? It's kind of big. Junk in, junk out. Or nothing in, very little out. So basically, this is the whole picture of the entire thing. And it starts with, this is just the sense of proprioception. That's eliminating the other 9 we talked about. Just proprioception from the neck alone. Do you understand why this is a big thing? I want this because if we understand that we have the ability to close the loop, then we can do a whole lot for our lives and people around us. What we do is we take very specific x-rays because we know if we can get that into alignment, part of the alignment, that orthogonal, that right angle, is actually to take the imbalanced strain on the muscles off so that we have balanced input from the proprioceptors. If we have balanced input, then we have balanced output. So it's not just about the pressure on the nerves. It's the easiest way to describe it, especially when you're kind of new to this, but the truth is we're changing the input far more. So we take these x-rays, we measure them down to 1/100th of a degree, and we make a very specific correction according to the x-rays that we take. This gives us the vectors to do it so that we can use math and physics in order to correct a bone. We're just moving a hard object. But the physiology changes, the input changes to your body, and therefore the output changes greatly. We set you up on the table very specifically, and when we set you up on the table, if we take everything away, you see the skull and the atlas bone. If it's out of alignment, then you're going to have an imbalanced strain, and therefore imbalanced proprioception, and a whole cascade of problems that follow. Some stronger than others, it depends on the person. We take those vectors and we actually use the percussive sound wave in order to make the correction. When we make it, it's painless, it's precise, and it's because it's a percussive sound wave. We're not actually touching you. We're using a very gentle mover. It doesn't need power. It doesn't need a pop. It needs correct alignment to create correct input. Yeah.
How does it get out of, this is like really, it might sound stupid, but
No.
how does it get out of place in the first place? And then once you get it back into place, however you do it, how do you keep it there without having
Balance muscle tension from good your body has to readapt to it and sustain balanced muscle tension. So obviously you need activity in order to increase tone. For those of you in the class,
so
we talked about that one. No, walking.
Anything.
I just go like this enough times, and eventually my muscles are going to get nice and toned. We don't walk that far.
So you don't see it.
We have cars.
Back out of place a lot.
A lot less when you use precision, and a lot less when you're able to allow time for your body to readapt. If you give your body enough time with the correct input, then the output becomes more balanced in a sustainable way. If you mess around with it before it's recalibrated, then you're really throwing off the whole system of the input, so your body's not able to go, okay, let's get a game plan here, let's figure out what's going on. It's trying to get just enough time, just staying still, not doing too much, to allow it to go, okay, that's where everything is, okay. That's the input I got from that, that's the input I got from that. Great, okay, so this is what we're gonna do. I want you to pull just a little bit here and a little bit there, a little more over here. Okay, just hold that for a little while. Okay, now hold that, and we're going to shift this other bone. Hold everything steady. Here we go. And you'll feel like a shift in your back. It may take like an hour or two. But that's what happens is your body just goes, and then everything else is stable. But it's a game plan. Your brain is executing a game plan for your body for healing.
So you should stay still for a while after.
For a while, yeah.
And then like symmetrical.
Yeah, absolutely.
Symmetrical exercise
first. Because you're saying balanced input, balanced output, balanced input, balanced output. And then you go, okay, we're gonna do one side and then the other. One side, the other, like let's say it's weights or something, right? I'm doing one side and the other. Input, balanced input at a different time so your body can start to cross-train, because eventually we're supposed to just move, right? I'm supposed to be able to move. This is not my life forever. Like that would be miserable. But for a little while, being a little more guarded and just being like, okay, just gonna give it time. Just gonna give it time. You wind up until the output is so powerful that you can interact and you can just flail around and nothing starts throwing out of place because the input's given, you've been given it time in order to get a solid game plan on how to interact with life without injury. if the injury is severe from things like car accidents and everything, it might take a little longer. And a lot of this stuff, for those of you who have been at the health restoration class, I mean, numerous studies have shown that the most common time to injure this is at birth. And it's not just the birth process, it's the assisting the birth process that does the worst. Hey, let's help out. Yank! I mean, how many of you would like to be lifted by your head alone?
Forceps around that.
And then have somebody else grab onto you and just say, I'm just going to give some resistance here, and sit down while somebody else is trying to lift you. That's about the equivalent of us taking a baby and trying to assist it out.
So is it supposed to be assistant or?
No. I mean, how many horses have you seen get their hooves and be like, come on, little baby horse, and pull another baby horse out of the mommy? It doesn't happen. Why do we feel it's necessary for us? I don't see it happen with bears or birds. Well, birds have eggs, but I mean, it's, you know, it doesn't happen anywhere else. What's our infatuation with helping so much?
Money.
It's money, and it's also a whole lot of harm, which adds to money later. Keep it up. We'll make lots. It's frustrating. It is. I'll be honest. But here's the thing. We have the opportunity to close the loop. And we can do it carefully, we do it safely, and very deliberately. And it's not just closing it physically. We talked about other ways we can close it. For us, and you were asking a little bit about this, we do our whole goal of care is to hold the adjustment. It's not to get adjusted. It's to correct it, allow time for your body to get great input, and execute a great game plan to keep it there. This is why we expect it to hold. It's because we understand that the input is extremely important to the output. And if we can allow time and the right steps in the right order in order to get that input strong and healthy, the output will reciprocate it. So, here's the example. Brain to body, body to brain. We talked about this. We talked about a couple things that happen. If you completely isolate yourself, if you're in an actual sensory deprivation, obviously we're going to get junk output. We've seen it, and there's very extreme examples in history of what happens when people go through that. We don't need to repeat history at all. It's frustrating that we ever had to go through it in the first place, but we did go through it. Let's learn from it. Okay? If we have brain to body with no context, we have nothing outputting, there's really almost nothing to express at all. Your health just spirals downward, and so does your mind. Everything goes haywire, nothing really works. You don't feel like you're anywhere or have anything or are anything. You're just there. That was depression, right? Just there. The expression of my identity is literally depressed. Do you understand how big that definition could actually be? I mean, are you diagnosed with depression? Sure. If you're you have junk in, if you have a closed loop or an open loop, and you have no sense of reality around you, I'd be shocked if you weren't depressed, honestly. That's the greater reality. So what we can do is we can close the loop. If we close the loop, we have the opportunity to change our entire physiological output, our mental output, and our relational output. Closing the loop would be things like taking away the interferences. Stop changing the thresholds so we don't feel what we're experiencing. Instead, sense it completely and immerse ourselves into things that will actually give us great input so we can actually have the expression we were meant to. That means moving your body. That means getting outdoors. That means breathing some fresh air, smelling some roses. That means eating good food, because not only is it good for you, but the sensation of healthy food actually fuels your mind and feeds it so it operates better. When you taste something savory, and I'm not talking Burger King, when you taste something truly savory that's naturally savory, it is soothing to your body. Anybody eat a watermelon on a really hot day? Like a cold watermelon? Oh, doesn't your whole body just like melt? Why does it melt? You have great input, and your whole body just goes, oh my gosh, never felt better. It'll make any bad day better, on a hot day especially. This is our reality. Go see some sights. Go see more colors. Go look for the Milky Way. Go to some mountain where the skies are clear and try to see it, you know. Count the stars or try. When you go outside, make sure you get under the sun. I mean, there's a whole study just about sunglasses. So when we go to the beach, we put like sunblock on because we're trying to stop the UV, right? Because we don't want to burn, but we want to get a little tan. But we all wear sunglasses. There's this book called Light, Medicine of the Future. This guy actually went through some studies, and he was saying, you know, a lot of people are so ritualistic about putting on sunblock as if that's going to give them the best defense. But the truth is that the best photoreceptors of how much UV light is in the atmosphere actually comes from our eyes. And if we have an accurate input of how much UV goes into our eyes, then our body can respond and tan us appropriate to the amount of UV in the environment. What do? UV sunglasses, zero UV in. So what happens when you lay on the beach with sunglasses? You burn, and you never stop burning because you never get an accurate assessment of how much UV is in the environment. Junk input in, junk input out. What's that?
Your mind's being blown.
Does this make sense?
Yeah.
And I mean, yeah, we do have some sense of it on our skin, but the majority of it is from our eyes. We UV protect everything, every windshield, everything. And we get burned while we're in our cars with UV protected windows. How is that possible? Because we have no assessment of how much is actually in the atmosphere. Junk get put in, junk get put out. Our nervous system is a sensory driven system. I think we're done, okay? There's a lot you can change. I do want to talk about two more things really quick. This series is going to continue. So we've already talked about movement and exercise, and this whole thing will repeat later this year. And we're going to do it on a different day, just so that people who can make it on Thursdays can make it. Next class is called Healing Power of a Peaceful Mind. And this is the class on emotions, and how emotions actually relate to your health. Anybody ever get stressed out? Do stressed out people look like this?
Yeah, that's mine.
Why are you physiologically manifesting your emotions? Why do calm people look like this? Stressed people look like this? Why do you feel like you don't work right when you're feeling sad, and you work better when you're happy? Why does everything feel better when you smile or laugh? Okay, that's emotions. So next class, Healing Power of a Peaceful Mind. It's going to be April 10th on a Thursday, 6 p.m. 6 p.m. I do have a sign-up sheet outside if you'd like to come. Looking ahead, we do have a health restoration class. I'm sorry, this date is wrong. Health restoration class is talking about more of the brain to body side of the nerve system. Okay, but that's actually going to be this Tuesday at 6:30 here at the clinic in this room. And then looking ahead a little further, so scratch that date. It's this Tuesday coming up. What's this Tuesday? 18th. Oh yeah, February and March are the same dates. And May 15th is the Health Fundamentals class, the last of the series on environment. And the last one that we did was actually on nutrition. So the movement and exercise one is online if anybody would like to look at it. Just look up Pierce Clinic FL on YouTube, and the whole class is on there. The rest of them are not on there and won't be on there.
Say it again. What was it?
Pierce Clinic FL. If you search on YouTube for Pierce Clinic FL for Florida, you'll find our YouTube page. And then on the YouTube page, there's the entire Health Fundamentals class on movement and exercise. It's the only one I'm putting the whole one on. So come to the rest of them, okay?
Some of this one on?
But I'll do it again, I promise.
Well, I'm thinking of people out of town that don't have the access to it.
Yeah.
We might come up with something special. And if we do, we'll make sure if everybody knows, okay? Okay. I want to end with this. This is a quote from B.J. Palmer. B.J. Palmer was the founder. He's the developer of the profession. His father was the founder. He was a little sloppier. B.J. Palmer was a very refined person. But he spent years refining this, and he wrote a lot of books, 30-something books. He said this: you never know how far-reaching something you think, say, or do today will affect the lives of millions tomorrow. Okay? We do these classes because we know we can change the community. We do these classes because we know that if somebody understands a little bit more about how they're made, instead of running to mask what we feel, we start to engage the world around us and change it. You have friends, you have family, share the information that you have.